Welcome once again to the DKA channel. I am Nurse David and I'm your host for today's episode. Have you ever heard the term alarm fatigue and wondered what it is? And why do we know so little about alarm fatigue? Yet, it is very present in our workplace and it has been known about for a while now. But there isn't much research or dedication into looking into alarm fatigue and its impact on healthcare workers. So in today's episode, we are going to discuss alarm fatigue. Let's start off by trying to understand what alarm fatigue is. According to the Journal of Clinical Nursing, which is JCN 2023, and Elton B. Stevens Company, EBSCO 2024, which I believe most healthcare workers know, especially nurses, as one of the most popular search engines in healthcare. And some peer review articles define alarm fatigue as the psychological phenomenon where individuals, such as nurses and other healthcare professionals, are overburdened with the sheer volumes of alarms, hence becoming desensitized to alarm sounds after repeated exposure, leading to missed alarms and delayed responses and compromise patient care. This means that alarm fatigue can put both the healthcare worker and the patient safety risk. So why do we not discuss this a lot, or why do we know so little about this? In fact, when I was looking into this, I realized that early research dates back into the 1970s, as the Elton B. Stevens Company 2024 on their website reported that the first documented study of alarm fatigue involved a 1974 report by the Emergency Care Research Institute, the ECIR, regarding the use of machines used to warm the bodies of patients suffering from hypothermia. The machines use various types of blinkers to signify normal function and burning risks. Because the lights blink continuously, nurses became desensitized to the signal and failed to notice risk indicators. Again, this puts our patients at risk, and also even the safety of the healthcare workers. But again, why do we know so little about this, or why don't we talk about this enough? Because we don't have enough research on this. Most available research online only focus on areas like the ICU and emergency room or emergency department, which makes sense because it's also the areas where we have a lot of alarms compared to other units. However, alarm fatigue, since it's a real thing, can affect and impact nurses in different departments in different ways. So I think there should be an extensive research to look at how it impacts the safety of both staff and patients in our department, and how we can best care for our own safety and that of our patients. Now, let's look at some of the findings or causes of alarm fatigue that were discovered in the available research. Number one is that they found that faulty devices is one of the factors that contribute to alarm fatigue. This can be related to sometimes the poor maintenance of these devices in our workplaces. The second point is false alarms. It discovers that most alarms that healthcare workers, especially nurses, will run to are false alarms, right? They are not even real alarms that really indicates that the patient really needs help. And so for that matter, we have a lot of alarms that people are running to that are not accurate or not real. And this can cause the staff to easily get tired, exhausted, and lack the interest or urgency to continue to attempts to these alarms, and may lead to them missing very serious alarms that need attention. Another thing they found to be the cause of alarm fatigue is the lack of knowledge and skills by the healthcare staff in the function and operation of these machines. That is where the care workers or people who attend to this alarm have less knowledge and less skills in operating this alarm, which I believe is very true, because you ask yourself how many healthcare employers really will hire you and specifically train you on the functions of alarms and how to operate them. Take the ventilator, for example. In the US, I know for sure that most ICU nurses would depend on the respiratory therapists to attend to those machines. And for that matter, little training is given to the staff on how to operate these machines, which sometimes makes it challenging for staff to be able to manage these alarms properly to avoid them beeping unnecessarily. The last thing I'd like to mention here is also related to the lack of training and operational skills. The research noted that lack of training on how to properly use and set parameters for the alarms also contributes to alarm fatigue, which ties into what we were saying earlier, right? If staff don't know how to set parameters properly, then the alarms are not set properly or correctly to individual patient needs. And for this reason, these alarms will go off when they are not supposed to go off, or would even miss a critical point. And so if these alarms are not properly used, then staff would obviously get tired running two unnecessary alarms, which eventually will wear them out and And once they keep running to these alarms and they realize these alarms are not really serious, they may decide to ignore, which in the definition states that you become desensitized. That means you don't even realize the agency of these alarms anymore because they are beeping all day in your ears. And most of us who work in the healthcare center knows what this really is. So my question is that why don't we actually have extensive research and training into addressing alarm fatigue? Because this will reduce a lot of stress on the nurses and the nurse technicians and those who are really supposed to attend to these alarms. I think this is something that has been really overlooked for a long time. And I want to know what you guys think and how much you know about alarm fatigue. So join in the comment and talk about what you know about alarm fatigue. And even if you really know that there are research about alarm fatigue that have recommendations on how healthcare system can really address this issue, let us know what you think in the comments. Now, let's look at some of the recommendations that were made by the JNC, the Joint Commission, and the few research that has been done on alarm fatigue. They suggest that alarms should be grouped into categories to indicate priorities. That means certain sounds or alarms should be assigned to high priority, and then certain sounds and alarms should be assigned to low priority issues. The second thing they also mentioned is the education of staff, which we mentioned earlier on how little trainings we are given as staff about the proper use of alarm and the appropriate settings for parameters when it comes to alarms. For that reason, they recommend that staff and clinicians should properly be trained on how to use the alarms and how to set the appropriate parameters for these alarms. In addition, they recommend that this should not be a one-time thing, but just like our continuous education that you have in your workplaces, this should be part of our continual education training. That means the training should be continual and staff should be updated when there are changes and upgrades to systems. I think this is a brilliant suggestion that would really help in reducing, I think, burnout and alarm fatigue. Because I believe that alarm fatigue is a contributing factor to staff burnout in the healthcare system. And so I think more light should be thrown on this issue and more education and training should be provided to staff to equip them to be able to address these issues in the workplace. I hope this episode was helpful. If you have more questions, please put them in the comments section. And don't forget to like and share this video with your loved ones and your co-workers so that we can draw more attention to alarm fatigue. Don't forget, we are on YouTube and Spotify, and you can also find some shorts on TikTok. This is the DKA channel. I'm your host, Nurse David, and thank you for joining us. I'll see you in the next episode.